Hello there. My name is Dr. Martina Assad. For those who haven't seen me, I am the owner dentist of MA Dental. We are located in the Marsh Air Force Base, close by there on the Van Buren by the National Cemetery in Riverside. And today we are going to be talking about a really exciting topic, which is bonding. So, what is dental bonding? And dental bonding is pretty much anything that you can stick to the tooth or glue it on, like a nail polish or like acrylic, for example. And we just put it with some chemical glue and we stick it on. That's what dental bonding is, and it's white in color usually. So, when is dental bonding recommended? And the answer, it depends. If you do have a great position on your teeth, like your bite looks great and everything is straight, and you have like a little gap here and there you want to close, that works. Aesthetically speaking, sometimes people use bonding to make the teeth look prettier, whiter, or larger. Sometimes there's a broken edge here and there, then some dentists do that as well. They stick on the white material or the composite, and then they bond it in. Some people actually use bonding when you have half of a tooth fractured. They actually can use your little piece that fractured, and then you put some bonding material in, and they glue it this way temporarily. So sometimes we make temporary fake teeth with it. There's so many applications for it. Advantages of dental bonding: it helps a lot to cover up certain areas of the teeth that are exposed for sensitivity, for example. That's one advantage that we usually find. Sometimes it gives patients a really great self-esteem for the way their front teeth look like, but that becomes usually a bit of temporary on the time frame, and we're going to get into that in a little bit. But usually bonding is maybe a temporary treatment for like a year or two, and after that we start to see chipping, or we start to see staining, and at that point you might look into permanent solution, as long as the spaces allow it and as long as your bite allow it. So it's all depends on what we use it for, but it's pretty advantageous. We also use it for buttons for Invisalign. It becomes really handy to move the teeth around. So again, so many uses for bonding. Do bonding teeth look natural? And the answer is, if the dentist has the eye for it and they do a really, really good work with aesthetics, yes, they would. But again, for a certain period of time, and then they eventually change color. But yes, they do actually they could be as aesthetically pleasing as you can never tell the difference. So which is better, bonding or veneers? And the answer that I always tell people, nothing beats being conservative. If there's an option for me to give you an aesthetically pleasing smile with just simple digital braces, I will do that. That requires no shaving of teeth. That requires no permanent going back. As far as bonding or veneers, I will tend more toward a permanent solution, so the patient is not dealing with the headache of discoloration, chipping, change in color, and that usually happens with bonding a lot more than would happen with veneers. So at that point, I would actually prefer the veneer side of things. So what happens during the dental bonding procedure? And the answer is, we go by certain steps, and usually if you skip a step, bonding fails in one way or another. So the first step, what we do, we clean the tooth surface. Sometimes we put a chemical acid on it, not harmful as long as it stick to the tooth, only tooth part. Sometimes we feel a sour taste, that's just the acid etch that we use. And then we have to rinse it really well and clean it really well. Dry it, it must be really, really dry. So if you're sensitive, sometimes the dentists have to numb you a little bit so they can physically dry it well. And then I like to put a desensitizer to make sure like it helps with sensitivity, especially for new bonded areas. Then after that, I like to put some bonding. It's similar to a glue, pretty much. And you dry it and you get the blue light to make it harder and make it stay. And then after that, we'll layer the bonding, and we layer it at 2 millimeters at a time, like a small increments at a time. And then after that, we'll hit it with the light again to be hard, so nothing shrink or nothing becomes soft under the hardened surface. And then after that, we polish it and make it look nice and pretty, and that's it for bonding. And usually we check where you're biting. Is dental bonding painful? And the answer is, most of the times, no. But sometimes it depends on how it's done, or it depends on the sensitivity of the patient. But most of the answer is no, it's not painful. Hygiene, brushing and flossing after bonding is very important, of course, But you also have to be mindful, especially if you have like a thin built edge on your tooth. You have to be very mindful. Like every time you have a vibrating toothbrush, like you're pushing too hard, or like say you're biting into an apple or something, of course it can weaken what you have. So brushing and flossing is normal as long as there's not a whole lot of resistance and not a whole lot of vibration. But of course, you want to keep your mouth clean. Are there special instructions for caring for bonded teeth? I always tell people, I prefer people, especially if you have something bonded in the front and is very thin, flossing up and down. That usually puts a lot of strain on the bonding. Or if you have very thin edge that is bonded in the front, again, you want to avoid eating hard foods. So I would floss up or floss down and pull through. That helps a lot. Sometimes too, you can use a water pick. That helps. Electric toothbrush, again, no problem as long as it not vibrates really, really hard. But the most important one, you're not supposed to open bottles with your front teeth, especially, or like hold pens, or like biting through something super, super hard. You will break your bonding. So you got to treat it like a very, very thin cover, or like a very, very thin veneer, which requires a lot of maintenance. And that's why part of the reason why I lean toward permanent solutions like veneers. How long does dental bonding last? And I think we possibly may have talked about it in the previous question. So they usually, I see them start to discolor or break or chip after possibly second or third year. So maybe duration about 12 to 24 months, roughly. Two excellent points a lot of people ask about is the cost of the bonding and if insurance covers it. And the answer depends. Depends on the surface and depends on the coverage of how many teeth are we doing and how many sides of the teeth, we call them surfaces, we're doing. So it goes up per the surface or the side. As far as insurance, if it's aesthetically pleasing procedure, usually likely is not a covered benefit by insurance, but you can always feel free to call us at 951-327-7247 or our website. You can feel free to visit at www.madentalpractice.com. We'll be more than happy to schedule you. We're also now available on ZocDoc and Google. You can also reach us at Facebook, Instagram, and our team is really eager and is waiting for you to come in. We can welcome you.